When we saw the first wave of COVID, in particular, hit New York City, some of the survivors of that first wave of COVID realized they were having symptoms that lasted longer, and they developed the name long haul COVID. The symptoms really vary individual to individual. They can range from shortness of breath, can also be chest pain, it can be a racing heart, it can be changes in smell or taste, it can be changes in memory, concentration, and focus, and it can be gastrointestinal changes like chronic diarrhea. And so it's really interesting. It doesn't matter the severity of the acute infection. You can have an asymptomatic COVID infection cause long COVID. You can have a moderate symptomatology, meaning my head was stuffy, I was sneezing, I was coughing, and that can go on to develop long COVID. We know the highest rate of long COVID is after someone has been hospitalized, and especially in the ICU. You kind of had a moderate case, and sometimes it does take 3 or 4 weeks to have recovery. And that would mean you don't have long COVID. But once you've hit about 12 weeks of not having full recovery, you should go in and see if you qualify for long COVID. It's kind of about taking care of your body. So focusing on good sleep and good sleep patterns, focusing on gentle, consistent exercise. And that might look like a 5 or 10-minute walk a day as a starting point. Sometimes getting some mental health support so that they are processing what's different about their life now than it was in the past. Yes, people with long COVID can be reinfected with COVID. At this point, I've had patients who have had 2 and sometimes 3 COVID infections over the last couple of years. And having long COVID doesn't give you any additional immune support to avoid reinfection. Vaccination is actually a really important tool. It can reduce the rates of long COVID by about 50%. So having your immune system have known antibodies and be ready to fight the infection is one way to help reduce the risk of long COVID. For example, in an unvaccinated person who got COVID and then got long COVID, getting even 1 dose of a vaccine series has reduced long COVID symptoms by about 40%.